my presentation will primarily be just a summary very brief summary of what Medicaid, what Medicare are. It may seem a little simple. Most folks here probably understand it, but I think we all need to speak the same language when we're discussing the impacts of recent federal budget decisions on healthcare, both nationally and locally. So I'd like to summarize first basics about Medicare, Medicaid, the ACA, the Affordable Care Act, then a very brief summary of some of the major components or impacts of the Budget Reconciliation Act, the so-called One Big Beautiful Bill, which may be a misnomer, and then a real brief summary of what some of the projected impacts will be nationally and at the state level, and then I will more or less defer to the other experts on Cortland County specifically as we get to that. And then finally, just a little bit of a more personal perspective from primary care trenches as to how these might play out, maybe the most important part. So initially, Medicaid is a government healthcare program started during the Great Society years in 1965 that covers low-income persons as well as persons with disabilities, both adults and children. It is a federal program. Some of the funding comes from federal sources and others come from states. It is administered on a state-by-state basis. It gets a little complicated when we get to the ACA in a minute, but essentially it's a joint program, although it's federally mandated and the feds set the basic standards. The states have a lot of leeway in how they implement them, and they do help significantly pay for Medicaid. It was significantly expanded in 2010 under the Affordable Care Act, aka the ACA or Obamacare, which raised the ceiling federal poverty level to qualify up to 138% of the federal poverty level. The estimates are that roughly 10 million more covered lives were added to the Medicaid program due to the ACA. 2 years later, a Supreme Court decision allowed states to opt out of that expansion and revert to the pre-ACA coverage eligibility rules. At this point, all but 10 states have expanded Medicaid under the ACA. So 10 states do not participate in the ACA, 40 do. And the stats over the last few years show significant increases in healthcare coverage in the states that do provide the expanded coverage. So it has added about 10 million covered lives. And the most recent data I could come up with, because it's very hard to get accurate annual data, roughly 92 million Americans are covered under the Medicaid program. And the cost 2 years ago was roughly $870 billion in total. That would be state and federal. Now, in terms of demographic breakdown, nationally, 37% of Medicaid recipients are children. It's a little bit lower in New York State, so 28%. So roughly a third are children. 21% are either disabled and or seniors. You can qualify for Medicaid based on some chronic disabilities. And often those seniors have what we call dual eligibility. They have Medicare and Medicaid coverage both. They make up about 21%, and as you see there, they account for 59% of the costs of the Medicaid program in New York State. By definition, it's an older and much sicker group, therefore their per capita costs are a lot higher. Currently, New York has about 7 million, roughly 7 million Medicaid folks. Cortland County, the numbers I found, just under 12,000 had Medicaid as of this fall. Won't get into managed care Medicaid, but the majority of folks in Medicaid programs are in managed care Medicaid. Now there's some other non-direct health care services, health insurance services. Maybe the most important one that not everyone realizes, Medicaid is the primary payer for long-term nursing home costs. Medicare covers short-term nursing and rehab, does not cover long-term costs. So if someone is a permanent resident of a nursing home, they will often spend down their assets paying for the care and then qualify for Medicaid. And a big impact on these cuts will indeed be on our long-term care population. Medicare. I think everyone's aware Medicare is the national or federal program for seniors age 65 and older. About 90% of Medicare recipients are in that age category. But it also covers folks with end-stage renal disease, and this was added when dialysis became widely available. And then adults and children younger than 65 with certain disabling chronic long-term medical conditions. As of this summer, just under 70 million Medicare enrollees, again 90% are over age 65, and about a quarter have dual Medicaid and Medicare, as we discussed earlier. And again, this is a high needs, fairly high cost group. And then roughly half of folks on Medicare choose a Medicare Advantage plan, which is a managed care Medicare program implemented by private insurance companies, and just under 50% are in standard Medicare Parts A and B. We could spend hours on Medicare. I want to leave it as just a broad overview. The ACA, we touched on it earlier, again, 2010, expanded coverage, and we talked about the 40 states and all that. This has long been a target of the Republican Party. Multiple attempts to block or repeal it were failures. This new bill is an attempt to try to undo some of the progress that was made under the ACA. Get to the right slide here, sorry. So the bill, and it's a massive bill, and I won't pretend to be an expert on it. I'm really going to narrow the focus just to some of the broad impacts that it will have on healthcare delivery in this country. The major cost of the bill is extending tax care cuts that are in place now, but were set to expire the end of this calendar year. Particularly benefits high wage earners. As you can see, the top 10% of income earners will increase their incomes by 2.7% long term, and the bottom 10% will decrease by 3.1%. In terms of health care, it directly cuts roughly 12% from Medicaid programs over the next 7 years, I believe it is. It allows the ACA subsidies. Those are federal payments that allow premiums for the affordable care policies to be reduced for low-income earners. They were grandfathered to expire the end of 2025, and it does not extend them. And as you've seen, this has resulted in the current government shutdown impasse, a major impetus of which is for the Democrats to try to force these subsidies to be reinstated to help reduce some of these drastic rate increases. We're seeing just since November 1st that the average ACA premium is going up by 114% on average. There's a wide variability, and some plans are going up a couple 100%. That is ultimately going to result in many people, millions of folks, having to either drop health care coverage entirely or choose plans with much higher deductibles in order to afford the premiums. The bill also increases, work requirements, and some pretty major reporting hurdles for the SNAP benefits. SNAP is the Supplemental Nutrition Program, aka food stamps. And we're seeing that went into effect November 1st, and we're starting to see in the news certainly lots of reports about the impact and responses to that. CBO, the Congressional Budget Office, supposedly nonpartisan, has estimated that some of the long-term impacts nationally is that this bill will increase the federal budget deficit, the long-term federal deficit by $2.8 trillion by 2034. Roughly 11 million folks could lose Medicaid coverage. Now, interestingly, some of those 11 million will be eligible, but they will not have coverage because the bill allows states to impose very strict reporting requirements so that people have to check in and fill out an application or update every month. And the estimates are that a lot of folks who receive these benefits, either Medicaid or SNAP or both, are just not going to be able to follow the regulatory hurdles, so that in effect, even though they're eligible, they just won't get coverage. And that red tape is deliberately built into the program in order to discourage utilization. And then there'll be a ripple effect. Even though the bill doesn't directly affect private health care plans, it will affect their premiums. As you know, if one major payer in the healthcare marketplace is squeezed, hospitals and healthcare providers and insurance plans end up with increased costs. They're passing those premium increases on even to the non-Medicaid and non-ACA plans. So the CBO estimates that the total will not just be 11 million, it'll be closer to 15 million who will lose health care coverage if this bill stands as written. And then they'll have particularly ill effects on rural healthcare providers and hospitals who disproportionately depend upon Medicaid revenue. And there's prediction that some of those facilities will have to contract or close as a result of this bill. The current shutdown is in large part driven by these issues, in that the Democratic position, large D Democratic position, is driven by wanting to reinstate or continue the ACA subsidies to try to prevent some of these ripple effects we're talking about. One thing I mentioned, it's a small piece, but it's critical, I think, to understanding a lot of the PR about this bill. You'll hear a lot of the Republican legislators talking about the Democrats just want to keep covering illegal aliens. To be very clear, undocumented immigrants have no legal right to health care in this country. They are not currently covered by Medicaid or Medicare, and it's a non-point. This bill does not cover them. They've never been covered, and the proposals from the opposition are not to add that. So you'll hear a lot about that as a bullet point, and it's just a falsehood. It does, however, somewhat limit legal immigrants' access to health care. So currently a number of groups, relatively small percentage, but a number of groups of legal immigrants can access Medicaid and Medicare, and that is cut back with the effects of this bill. Fewer of those documented immigrants will be able to obtain health care. Very briefly, because I'll defer to Leah more on this, but New York State impacts, again, projections, rough projections, that 1.5 million people likely to lose health care coverage, 300,000 likely to lose food stamp benefits. Total projected shortfall for New York State health care would be about 13 billion, and then 8 billion of that is through hospital and healthcare systems, which New York State will attempt to stopgap and use some state funds to make some of that up, which will then unfortunately mean diverting billions of state dollars to healthcare that could be used for other essential services as well. So it's a real conundrum. So just to wrap up here, and I left Cortland County out specifically because I think the following speakers can speak to it much better than I can. But just from a primary care point of view, these are real people. Taking care of folks for so many years in our community. A good chunk of our community is covered in part or fully by both Medicaid and Medicare. Many of my elderly patients have both. And interestingly, the percentage of folks on Medicaid, which people think of people who don't work, 72% of New Yorkers on Medicaid, adult New Yorkers, are working either part-time or full-time. So the vast majority of folks, adults on Medicaid, are employed. They just aren't earning enough money to afford private insurance. A lot of small business owners, their health coverage is through the exchange, the ACA exchanges, and their employees are covered through the ACA exchanges. So one real tangible effect on our community will be small business owners who provide health care to both themselves and their employees will have a very hard time in affording those premiums if they're doubling, as is projected with this. Local nursing homes, as we talked earlier, Medicaid is the primary payer for long-term nursing home care. And as that is cut, these nursing homes, which are not very profitable to begin with, and as everyone's aware, are really struggling with costs and staffing, a 12% hit to their bottom line is going to put some of them out of business. And then just from a more narrow primary care perspective, a lot of primary care medical offices, both private and health centers, operate on a pretty thin margin. And Medicaid is a significant component of that. And if that funding is cut and fewer people are insured, so they're seeking less care, it's going to be a real hit to the primary care services, especially in a rural area market like ours. So the ripple effects are real, and they're going to affect our community and people. Some people may be in this room, but certainly people that we know and that we work with. I went too long. I apologize. I'm going to turn it over to Bonni.
Bonni? Yep.
Well, I'm going to get going since we do this. So a couple of more general things. I'm going to try and paint a picture of what this might look like for us in Cortland County. But to step back a little bit, Kim talked about what I do, but that's mostly currently. I've been working in public health for 35 years. I've worked in cities, I've worked in rural areas, I've worked in, can everybody hear me?
No.
No.
Put it right, right there.
Got it.
In the
Oh, put it in. Okay, anyway, so, and for most of those years, I've seen progress. And that came to a screeching halt. And that worries me tremendously, not from a political perspective, but from a human perspective. Another big picture thing I just want to throw out there, in public health, we talk about the social determinants of health. There are 5 of them. They're big categories, but it's the idea that things like our health, the quality of healthcare and the access to healthcare that we have in a community affects our health, as does our access to education and the quality of our education, the economic stability in a community. Those are 3 of the 5 areas. The other 2 kind of our physical environment, what we live in. I think we can probably all understand that. And then a bigger kind of talk about civic engagement and involvement in the community. So when we see some of these changes that are coming and we think about a place like Cortland County, it's affecting those 3 big areas, which is going to affect everyone's health. Not just the people who are losing services, not just the people who are losing access. It's going to affect your health and your ability to get access. It may be decreased. So if you think about someone in your family or your neighbor or someone you work with, okay, if they have any of these services and they lose them or they get cut, okay, they are going to be sicker. They're going to have to make decisions about what am I going to pay this month? Which comes first? The heat, my food, clothes for my kids, or my healthcare premiums? Fine, that's still just them, right? Okay, so now we have a communicable disease outbreak and the neighbors come over and they visit with you for a few minutes. You are now just at risk because they could not get access to the health care that they needed. It was too expensive. It wasn't there. If we think about a fact and a piece that I don't think a lot of folks who don't work in this area know or appreciate, and that's okay. Medicaid provides funding. This is fairly recent, but it provides funding for services in schools. So students who require some counseling and mental health-based services, who require some occupational therapy services or some PT services that would get covered by Medicaid, the schools provide those services on site. They are accessible, right? They're there, they're in a building where people know the students need to be in that building anyway. That's a good situation, right? It's a great situation. It also, the Medicaid funding, provides money for the school districts to pay those providers. So that's good. If that goes away, and that's part of what's being discussed, the schools still have to provide those services legally. And now they don't have any extra money to pay the people who need to deliver those services. What does that mean? Your school taxes go up. Thank you, Sarah. Thank you, Sarah. Tony mentioned the whole Webb piece about provider costs for everybody will go up. Insurance costs for everybody will go up because they are getting lower reimbursement, fewer patients, fewer clients. They have a really tight bottom line. So then your costs go up. We might have clinics or closing or physicians who just don't want to do this anymore because they're not making it. That affects access, not just for the people who have Medicaid or who are mixed up in the ACA thing, but for you. In the 35, I think, years I've been in Cortland, we've seen an increase in the access of healthcare services. It's been pretty dramatic and it's been pretty cool. That may not be sustainable when these go through. So now we have to go to Syracuse or we have to go to Binghamton or we may have to go to Ithaca, which makes it much more difficult for those of us who are in a good situation economically, things like that. But you think about the folks who don't have transportation, don't have reliable transportation, how are they supposed to get there? How are they supposed to get treated? Even if they still have some semblance of coverage, how are they supposed to get there? We know in the work that I do that every additional barrier you put in front of people to seek the care that they need puts them another mile away from actually following through with the care that they need. And I look at this bill and I see so many additional barriers that it's going to affect. And again, this might be your neighbor, this might be somebody you work with, this might be another family member. So when they are sicker, you are more at risk in many particular situations. So we have that part. I have a little list here. All right, what else did I want to say? So it's really this interconnected web. You can't just say, oh, that's too bad, but I'm good. Because you won't be good. You won't be good because your taxes will be higher. You won't be good because you're more at risk. You won't be good because somebody is going to have to pick up the slack. And you need to think about that. You're all here, so I'm assuming you're pretty civically engaged, and I see many folks in this room I've seen over the years who have been engaged forever, and but there's other people out there. All right, so let's talk a little bit about, I have some specific things I want to do here. I decided not to go with the slides here. All right, so let's talk about that impact on the schools for a minute, and I want to weave in this idea of what's happening with the SNAP payments, okay? One of the things we do know is the school food programs have been really successful, I'll get rid of really, have been successful in cutting some absenteeism issues, in helping students pay more attention in school, which means that they learn better, which means that they have better, remember that little educational quality and access bucket, social determinant of health. It sets them up for a much better situation. So part of what's buried in some of these things is that if school food goes away or gets a hit, we're going to go backwards in some of those pieces of progress we've made with kids in schools. The studies just started coming out about 2 years ago. The free breakfasts in districts that provided free breakfast for every child had great return on investment for things, again, like absenteeism, quality of the food that they were eating, which is directly related to how healthy they are. So that's very important to remember. The SNAP, that's currently my soapbox, I'll be honest. The SNAP changes are fundamentally flawed if we think about the bigger picture of how to create healthy habits, how to support growth and development, physical development, cognitive development. So we cross this with the families who have less money because they don't have Medicaid anymore, or it has gotten cut, and they have the SNAP benefits. And so what happens? And you know, food costs more, right? I'm feeling it. I don't know about you, I'm feeling it. And so what do we see? We're going to see, I just need to get calories into my kids. The parents might not be eating. There's lots of research out there that tells us that when food is scarce, the mothers in particular, they will not eat. That affects their health, it affects their ability to parent, it affects their ability to work well on the job, which affects all of us in some way or other. So we see this idea of the interconnectedness. It's not just about Medicaid cuts, it's not just about the SNAP. It's going to have an effect, a little bit like dominoes. Let me take a breath. All right, I want to make sure I hit some highlights. I talked to Nikki and Jessica, our public health director, you know, what's most important for us to do. Let me see. So as Tony brought up, the more hoops you put in place in front of people to jump through in order to get their coverage, having to re-enroll and reapply, that's coming up with SNAP, that's coming up with Medicaid, lots of folks are just going to give up. So that is a huge problem. More locally, we have these things happening. We have services that might not be provided someplace else, or they're not accessible from an economic perspective. For us, that means the caseloads and the work for the Department of Social Services is going to increase dramatically. We're going to lose workers. They are an insanely dedicated bunch. I don't know if any of you are in, but insanely dedicated bunch. But there's a point where everybody, they can't do it anymore. So again, or they have to hire more, which will increase our county budget. Again, taxes. And we already talked about cost shifting, so I'm going to stop right there. The other thing that I just want, remember, we do know when you look at the public health data and the mapping, love GIS maps for what you can do to look at data and things like that, we know that different parts of our county experience many of these things at different levels. Some have harder, different profiles than others, but everybody, this is going to cause all the counties to get closer, but at a lower level. And Kim's standing up, so I'll be quiet. We can answer questions later.
Thank you so much.
Well, I know my previous speakers have pretty much said it all. So I will definitely use the mic because I don't want to get the, hey, I can't hear you right now. Hold on. Good evening. So I guess I'll start with just a kind of a general kind of state of things. I would be remiss if I didn't mention, in thinking about the mission of the League of Women Voters and your very important work that you do to inform folks about their civic, not only responsibility, but right to engage in a democracy. I will say to you all that the current state of affairs is that what we are witnessing right now is a very intentionally designed dissolvement of our republic as we know it. And there are a number of efforts that I'll speak from the state perspective that we are working on, but I will be honest, every day it literally feels like we're trying to put out 1,000 fires at once with very limited equipment. That keeps also getting taken away. So I will just say, just to kind of get a sense of, folks' awareness in the room and just experiences, how many folks in the room, by a show of hands, know someone that is currently utilizing SNAP? Show of hands. How many folks know someone that's currently relying upon Medicaid? So most of us in this room. And so as my previous speakers and colleagues have shared, this issue with regards to Medicaid, SNAP, is impacting all of us, whether it's directly or indirectly. And so I'll just lift up a couple of points from the state standpoint, so I want to make sure we have enough time for you all to ask questions. I think we're scheduled to end at 7. Yeah. 7-ish. So I want to make sure we get to questions I know you all may have. So I'll first start with SNAP. So folks may be aware, last week the governor declared a state of emergency related to the SNAP cuts and withholding of the funds related to SNAP. She pledged $101 million across the state to provide direct funding to our food pantries, our food banks, other providers who provide food to many residents here, not only in our region, but across the state. At the same time, today, actually as a few hours ago, I'll take a step back. On Friday, it was announced that our state attorney general, Tish James, in conjunction with other attorney generals across the country, around 23, were successful in fighting back with regards to the withholding of SNAP funds, which again, the current withholding actually violates existing federal law. And in fact, no other administration, even the current administration, who has been in a case where it's been a government shutdown, has actually withheld these funds. So this is unprecedented in that regard. And so litigation was filed and judgment was rendered that in fact the federal government must release the SNAP funds that have been encumbered to help pay for the SNAP program. I will also share that as of when that decision came out on Friday, the federal administration was saying that they wanted to check the legality of that decision, but then fast forwarding to today, in conjunction with the Department of Agriculture, federally speaking, the administration announced that they are going to release partial 50% of those funds. Now, one of the things that the state is doing, our Office of Temporary Disabilities Assistance, also known as OTDA, they are currently trying to figure out, one, how those funds can get expedited from the federal government, which comes to OTDA. Can you also hear me okay? And then two, if they being OTDA, could fill that gap while they're waiting for those funds to come in. So that's currently being worked on. As of November 1st, everyone knows that SNAP benefits for November were withheld. Even with this recent judgment, we also know, by we I'm talking about providers on the ground, have expressed, most certainly state agencies have expressed that there will be a gap in getting folks back online essentially. So they have continued to encourage folks to still recertify if you currently receive SNAP benefits and if you don't, because the stats that, just for our region, by region, I'm talking about the southern tier, there's roughly around 40,000 residents that are reliant upon SNAP in the southern tier. So within like the 6 to 9 county region of the southern tier. And so they are encouraging folks to still sign up, but also there's a number of folks who actually do qualify for SNAP and have not signed up. So that 40,000, if we were to fold in folks that actually are eligible and have not signed up, that number goes up significantly. So I just wanted to lift that up. Another concern that we are also trying to address, because as we continue to get a little colder, because fall is still here for a little while longer, is the growing concerns about utility costs. And so last week, AARP and PULP, which stands for the Public Utility Law Project, I've worked with them over the years during my time in the Senate. I know Assemblymember Kellis and I have hosted and continue to host joint utility clinics with them. Submitted a letter to the governor asking that there be a moratorium put in place to have utility companies not to charge folks while this SNAP crisis is happening. And so another one of my colleagues is actually doing a letter to the governor asking for, again, additional consideration. There are other states who have not only asked for a moratorium on utility bills, they've also asked for a moratorium on water shutoffs. So again, these are some of the things. I will close with this. I want to make sure we get to questions. Make no mistake that even with the court ruling to release the funds, we're still in a federal government shutdown. And to the points that the previous speakers made, a big driving factor is the concerns about healthcare costs and premiums going through the roof. But this isn't just simply for folks who are on Medicaid. I'm also talking about the ripple effect where you're going to have folks who are currently insured become underinsured, and then the underinsured becoming uninsured. And so that ripple effect will happen most certainly exponentially. And also at the same time, as a state like ours in New York, where about 80% of our state budget goes towards healthcare, it is going to be a challenge to backfill any of these cuts, even with additional revenue raisers, because we definitely need those federal dollars. So I want to kind of wrap it on a more positive note, because I feel like there's been a lot of, but that's the reality. We're in some real dark and uncertain times, but what I want to wrap with, and then I know we'll open for questions, I have to say, I've been working with community partners all over the district, and I want you all to know that there is a concerted effort by so many amazing providers here in Cortland, in Tompkins County, and in Broome County that are coalescing and actually have formed coalitions to provide community supports, whether it's through mutual aid, whether it's directly through food supports. And so I've been a part of a number of these coordination meetings. So people are definitely working very hard. And my call to action to all of you is to reach out to these various community stakeholders like our food bank, most certainly of Central New York, of course, Catholic Charities. There are a number of folks that are working on the ground. A lot of our faith-based organizations do have pantries. They are looking for folks to volunteer. If you donate funding to the food bank of Central New York, as an example, a lot of our food banks have what's called wholesale purchase ability. So just to give an example, 1,000 pounds of chicken that a food bank can purchase may cost them like 75 cents a pound. Now, none of us have gone to a store in recent history and have been able to buy 5 pounds of chicken or 8 pounds of chicken for 75 cents a pound, I'm just saying. So those direct dollars help because they can actually purchase food. In addition to that, it's staying aware. And the last piece of my call to action, this is the League of Women Voters. And I would be remiss if I didn't mention that it is important for you to call our members of Congress, the entire delegation here in New York, and urge them to, again, not only resume government, but to make sure that our communities continue to have access to quality, affordable health care, food, all of these essential needs that regardless of your zip code, we are all still human in this room, yes? And if you're undecided, you're still welcome, okay? But food, shelter, heat, these are all essential needs. These are not luxuries. They are something we all need regardless of your income status. So I would encourage you to most certainly reach out to our members of Congress across both aisles. And of course, my office, we're continuing to send out through our newsletter, also working with various stakeholders across the district to share all the different resources that folks are making available. So I will stop there so we can get to the questions. Thank you for the invitation.
Thank you. All three of our speakers were fantastic. And now if you guys want to come down in front and maybe take a seat. And I would say that Senator Webb is definitely amped up the atmosphere in this room. And so with that, I will start by asking, do the three of you have any questions that you want to ask each other from listening to your conversations? Okay.
I don't know if it's a question, more of a note of continued encouragement. I think that to me is what's most important, is putting out in terms of the data pieces that you shared. And of course, a lot of folks don't even understand what social determinants of health means, but we live it every day. So I think all the things that we're doing individually and collectively are most certainly important. That's my response to your question. So it's kind of a little shift, but yes.
So there were some questions asked when some people signed up for this event, and I would be remiss if I didn't mention some of these. So there was a question regarding the current vaccine requirements for school and immunization rates in Cortland County. And I feel like Dr. Hodges, maybe you could discuss this. I know I did a little research myself, and our vaccination rates are quite high in New York State, but they are beginning to dip.
True, but there's overall vaccine rates, then there's school vaccine rates.
Mm-hmm.
And this, to go to public schools, you have to be vaccinated in a whole host of things that I will not Go on. So we had I believe it's 97% of all the students in schools are vaccinated fully. There are some who have some exemptions or whatever, for whatever reasons, but it's very high, and that shouldn't be surprising because you can't go to school. The adult rates are a little bit more difficult to get because it's by vaccine. So what percentage of this vaccine, what percentage of that vaccine? We're all over the place, but the big picture again is that those rates have come down since 2020. Not just in Cortland, but everywhere else, also in Cortland. Also important that that's one of the areas where different parts of the county have different rates of adult immunizations. So some are as low as, and I'm trying to make my memory work here. So some are as low, they're hovering around 60%, where the county overall was sitting at about 80%, but that's everybody.
Just a quick update on New York State versus national vaccine recommendations. As everyone's aware, under RFK Jr. and cleaning out the ACIP, the American Committee on Immunization Practices, the feds appear to be really backing off of vaccine recommendations and mandates. New York State, as part of a compact with several other states in the New England area, is going to stick to its guns and no longer blindly follow the CDC recommendations, which have become much more lax. So I think in this state, in terms of school immunization rates, but also in terms of what's recommended and covered for adults, New York State will very likely maintain the high standards that we've had. Now, in terms of adults, those vaccines are by and large voluntary, unless you work in healthcare, et cetera. And we definitely are seeing a dip over the last 5 to 10 years. But New York State is not going to hand the baton to the feds in this case. I think you'll still see the guidelines and, equally importantly, the coverage, because if someone says, I'm going to get the vaccine, but the insurers are not mandated to cover it, there's a good chance they aren't going to get the vaccine. So I think New York State will do a decent job there.
One thing to remember whenever these days, well, actually since last January, but more recently since the shutdown, a lot of the sources of these data points are not updated anymore, or they are inaccessible. So we don't have current, I teach a class at the college where they have to go and look at all these data, and right after the shutdown, I'm getting all these panicked emails. You told us we had to go this, and the website is telling us we can't access it. Well, yeah.
Civics listen.
And it was literally overnight.
Yes.
Can I just add one quick point?
Absolutely.
Cortland County does participate with New York's immunization information system, and so again, as data comes in, and most certainly to the points that are already made, there is a mechanism you can put in your zip code to get a sense of specifically MMR immunization reports. But again, to the points I already made, that New York, most certainly from what I am aware of, does not intend to not continue to require immunizations for children who are in public schools, and it will continue to be voluntary for adults.
A question? So the exemptions to the vaccination requirements in New York, are they religious or medical? Or are they both?
They are both. The vast majority of kids who aren't vaccinated turn out to be medical exemptions. They've had a high fever, et cetera, et cetera.
College students as well as K through 12 are required to be vaccinated.
Yes.
Against certain.
Others
are highly recommended, like meningitis, et cetera.
Question up here?
Yes. Alia.
So here the rules for hepatitis B and COVID has changed for school-age children. So what's happening in Cortland right now? Is the school not caring for the federal rule, or is following the old rule? What's happening in Cortland County?
Is that regarding COVID vaccine?
Hepatitis B.
Oh,
and-
hepatitis B, I'm
and
sorry.
COVID. The rules are changed for kids.
I'm not sure what the
I'm not sure what the
2025 school
current
regs
with Hep B
reflect.
is, for kids or adults. I'm trying to picture the thing, I don't think I have it here on my, but anyway.
Well,
So
currently
maybe
the
we can get back to you
that's
on
a
that.
different, hepatitis B has been recommended as a first dose as a newborn, and I believe the CDC and ACIP just said, no, you don't need to do that.
Yeah, so, yeah.
Not sure how that's gonna shake out in Cortland County in New York State.
So another question we have is about our homeless population here in Cortland County. The question is, do we have any health data on that? But I'm going to add a little bit more on that. I know that with the new rules associated with SNAP, in order to receive SNAP, you need to work 80 hours a week. A month, excuse me, a month. It'd be hard, okay? 80 a month. And that is now including homeless people, whereas before it did not include homeless people. So, that sounds like it might be a little difficult for homeless people to be working 80 hours a week. A month. And so is there any thought, Dr. Hodges, regarding how we might intervene in that and be beneficial to our homeless population and not increase our homeless population, actually?
There's so much in that question.
Sorry. Would you like this?
No. So my big answer is Catholic Charities does the bulk of the work with our unhoused population in the county. They do tremendous work. As far as intervening, they have written grants, they have gotten money to provide services in certain areas and all sorts of things like that. We don't have good data on the unhoused population all by itself. It's just not there. It's difficult to collect, while the unhoused population is a priority in many areas, there are so many other priorities from the health perspective that that just draws people away from some other things. There was an attempt in the last community health needs assessment to get some data, but it wasn't necessarily the best data we get.
Yeah, and I'll also just add in that same vein that health and housing access are absolutely connected. And if you're someone who is experiencing chronic houselessness, it becomes very difficult because you're not necessarily thinking about or maybe are seeking out medical care. So to our point, that does make it difficult for collecting data, but at the same time, from an investment standpoint, this is something that most certainly here in the state, and most certainly I have prioritized along with Assemblymember Kellis in pushing for more affordable housing projects here in the region, more supportive housing to help individuals who are struggling with mental health challenges, substance use disorders, to really help to provide wraparound services. And that's why the supportive housing model works, especially for individuals who are unhoused, because there's often this kind of layered effect happening for individuals who are constantly in a state of transition when it comes to, or they're housing insecure, most certainly. But there's definitely more that needs to most certainly be done in providing more quality housing programs and access, and especially for our providers on the ground that are most certainly providing supports. This is something that at the state level, we're, especially during the budget, I will say in our Senate, in our Assembly, One House budgets, we're constantly pushing for more funding in these areas for these reasons.
There's another comment here.
Okay. Doug Ronner, Family Doc, Family Health Network. I'm a direct provider of medical care for homeless in our mobile medical unit which is outside of Loaves and Fishes, and the Rural Health Institute, which helped run the Gray Space last winter, did obtain data of the people that were making use of that space. You can, I think, access, they gave a report out at the end of their term there that was very interesting. About a third of the population that were making use of their services had a substance use disorder. Probably another third had some sort of diagnosable mental illness. Actually, a significant number of people were working. Okay, more than you would think. Okay, so actually, the 80 hours a month, that some may still qualify if they're able to actually access to it. But the big issue is the instability that they're experiencing because they're going from one warming center at night to another warming center during the day, and then when the warming centers close because it gets too warm, then they're scattered. And one big issue, if you have chronic medical conditions, that's a big issue because your belongings regularly get stolen, and that includes your prescriptions. Okay, so that's a big deal. It's not just a matter of getting health, housing, and food, etc. It's just, can I keep my stuff? Okay, so that's something we don't think about in our middle class environment, but that's a reality.
Thank you.
That also takes us back to the homeless situation and trying to find housing for these people
Yeah.
so that they have a place that they can put their head at night. Yes.
I have a question for Senator Webb. How does Cortland compare with other counties that you represent? Cortland County as a county doesn't provide any homeless shelter. It's up to private organizations. Do other counties around us, do the counties provide any service?
So I know in Tompkins County, there's a project underway that Tompkins County is actually leading to create an actual shelter in Broome County, but again, there's limited, well, certainly units in that way. I would say in Broome County, it's a combination of both county and private. Similarly, there are some things in Tompkins County in that same vein. In Cortland County, I know that our office has been, along with Assemblymember Kellis, has been supporting. It's a private developer that's looking to actually in Cortlandville establish an affordable housing project. So I would say in other surrounding counties, it is that combination of private and public. I think one of the cases I've been pleading to our State Department of Housing and Community Renewal, or HCR, is to work with our CHODOs, or community housing development organizations that exist on the ground. We provide funding through the state through two mechanisms, not the only ones, but these two in particular, the Rural Preservation Program and the Neighborhood Preservation Program. These are funds that are specifically allocated to local developers that are CHODOs, as I mentioned, that are actually doing housing. It is my hope that we will see more public opportunities made available, especially here in Cortland County, especially in the area. Broome County just announced about a week or so ago, they did a tiny homes project for veterans. And so I know there's conversation of, and that was both a private-public partnership. I know that there is some talks of trying to replicate that model, most certainly in other counties as well. So it is definitely a work in progress, but it's something that absolutely I think it's important to lift up here in Cortland County. And I would encourage folks most certainly to connect with county leadership, because from a state standpoint, we are pushing, Assemblymember Kellis and I are pushing for more dollars through the state budget to come to areas like ours in Cortland County, but having those community housing development organizations on the ground to tap into some of those funds would also be helpful.
So I'm going to step in as a League of Women Voter person here. please contact your county legislators and come to meetings occasionally, because when we show up, they hear us and they listen. So, but we have to show up in order for that to happen. Yes.
Can I just ask a question about free lunch? My grandchildren go to school in Cortland, and they are provided both breakfast and lunch. Who's paying for that? And therefore, by extension, is it at risk?
So if I could repeat the question so everyone could hear it. The question was, school lunches and breakfast is actually paid for or is provided to students in Cortland County. And the question is, who's paying for that?
I don't know if it's the whole county.
Oh.
I just know the city of Cortland.
In the city of Cortland, excuse me. And the question is, are those funds at risk?
So I will be absolutely upfront and say, didn't go back and look at that, but it's school lunches in general are a combination of federal dollars and state dollars, and some of it comes from the Department of Education, some of it comes from the USDA. It's a complicated funding process. A number of years ago, districts, certainly in New York, but in some other states, where they could say, we want to provide free for everybody. And that was mostly federally funded, but there were some state funds in there. I don't know where that is right now, to be honest with you.
I will say to you from a state standpoint that in this year's budget, we were able to get to 100%. So every single school across the entire state is now eligible to receive free school when we did the budget last year, we were only able to get up to about 95%, but in this budget that we just completed, it's 100%. So that's all of the schools in Cortland County are receiving free breakfast and lunch. To the other part of your question of, is this funding at risk? When the federal government made cuts to the school lunch program, it then has fallen on the state to make up that difference. I will say for now, the state is doing that. What that looks like in the future, given everything that's happening, that is yet to be determined. But I will say that there is a overwhelming majority of folks, and I'm saying across the aisles, everyone, this is an issue that there is significant bipartisan support in making sure that no child in our schools are going hungry. And so I imagine as we go into this next legislative session and deliberate budgetary investments, that this is something that is definitely top of mind. And I know most certainly the intent would be to maintain what we're able to accomplish in this budget with keeping at 100%. But again, there's a lot of different things on the table because a lot of items are being further pushed to the states overall, not just simply our state, but as of today, we're at 100% school meals being fully funded.
I taught in Syracuse for almost 40 years, and it makes an enormous difference if children get breakfast and lunch. And when I started teaching in the mid-70s, teachers brought in food for kids, and it's a vast improvement.
One of the things that is a little wobbly right now, so from a health perspective, some of the money that came from COVID funding and things like that allowed, and this is federal money, there was a program called the Local Food for Schools, and the Local Food Purchase Assistance Programs funded both food banks and schools to connect with local farmers and food producers so that local food could be used in the schools.
Yeah.
That right now.
That's because of the farm to school program.
Yeah, and that's what do
That's
that.
good.
That was $1 billion. And that's probably gonna go away.
Okay, just a sec. Oh yeah, go ahead.
So, you mentioned about small businesses that are going to be affected when it comes to healthcare premiums, and one of the things that we have seen and brought up is there's a lot of mergings going on So my question is, do you see anything like health insurance-wise, companies merging, any more hospitals merging? As I've heard, and correct me if I'm wrong, it was either Medicaid, Medicare, both, but they're sourced by third parties. So any comments or concerns about that? Maybe some issues about that going on? If you need me to clarify a bit more.
Would you like to take
Yes,
this,
a
Tony?
couple quick things. The reason small businesses struggle getting health care for their employees is volume matters. If you don't have a certain minimum number of employees, usually it's 30 or 50 or more, it's hard to get competitive rates from the commercial private insurance companies. It's hard to get competitive rates anyway, but it's harder if you're a small business. That's why many small businesses have turned to the ACA, the exchange, for their employees. So yes, if a larger company subsumes smaller companies, they generally have more leverage and can get better rates and are more likely to provide decent health care coverage. What's more likely to happen is some of those small businesses are going to go out of business. They won't be taken over or absorbed into larger businesses. They'll fold. You know, they're small business owners who are barely getting by and hit to their bottom line on healthcare premiums, including their own healthcare coverage for the owners, is liable to put some of them out of business. In terms of the private-public marriage, we talked a little bit about that. 80% of Medicaid recipients in New York State are on managed care Medicaid plans, and that's where the state basically subcontracts to private insurance companies to provide Medicaid coverage versus standard Medicaid, which is a state program. It's very parallel or comparable to Medicare Advantage versus standard Medicare. Standard Medicare, the feds run it, Centers for Medicaid and Medicare Services. You have Part A, Part B, you can buy a Part D. It's all through the federal government. If you sign up for a Medicare Advantage Medicare plan, you're contracting with a private company, Aetna or Excelis, or there's 5 in our area, and they get X dollars per member from the feds, and they then manage the plan. So you're contracting with a private. So options are there for both Medicaid and Medicare to have either the public managed option or a private company run it. And it's 50-50 split in Medicare right now.
And I'll just add in that same vein, a number of us in the legislature, which is why we support the New York Health for All legislation to create a much more affordable option for healthcare for community members. For these reasons and others, I have not seen as of yet conversations. I don't sit on our insurance committee in the Senate. Most of the conversation that I'm hearing from insurance companies is looking to have the ability to raise premiums because of rising healthcare costs. And from a public health space in terms of insurance, one of the things that we're constantly trying to tackle and address with providers is Medicaid reimbursement rates. They have in large part been very flat or have had very limited increases over the years. But given, again, the growing needs, that is something that I'm hearing from healthcare providers all over, is that we need to increase our Medicaid reimbursement rates, because that is a major factor with having more expanded ability to provide care to us in the community.
Thank you. Dottie?
Just heard the word insurance. I have, because I'm legally blind, I have an aide 20 hours a week. I've never spent that much time with somebody at a real poverty level. She just came out of the hospital 10 days. She has some bizarre condition where she will go on a certain prescription for the rest of her days. It costs $1,000 a month, and her insurance won't pay it. What is she supposed to do?
So did you guys hear that? So Dottie is legally blind, and so she has an aide who comes in and helps her 20 hours a week. Unfortunately, that aide was ill and ended up in the hospital. She's now come home, but she is on medication that costs $1,000 a week or a month?
A month.
A month. $1,000 a month that is not covered by her health insurance. So Dottie is asking, what should she do?
So, Ms. Dottie, I would actually have your aide reach out to my office because we help to connect residents with different healthcare resources. So I'll make sure you have my contact information so that way we can do some additional follow-up to see what are some additional options. Well, certainly.
Right now, I've been able to help her. And so she's covered till the end of November. So hopefully we might find something by then. I will.
Matter of fact, Lauren from my office, he's gonna give you our card and that way we can follow up.
Yep. Thank you. Okay, I was just told it's 7:30. One last question on the top here, and then we're
Can we
done.
go back to one of the very first questions about people that decided not to take the gene therapy shots for COVID back in 2021? We have two large groups in our community. We have the Amish down in Marathon and around there that didn't take them. We also have a fairly large homeschool group that meets in Homer every Tuesday collectively from their homes to do week engagement. How has their health care been since 4 years ago when this all started versus the general public? And the second question is, people that chose to take those shots or were forced to take those shots, how come our local health department doesn't tell any of us at all, if you call there, how many people have died since 2021 that had chosen to participate versus the general public that didn't, and how many, they can't tell you.
Because we don't have the data.
Why? Everybody was discovered in 2020, they died either with or from COVID, but now we can't tell whether they took or didn't take any type of shot.
So a couple things that I'm aware of, there may be more. One is that the death certificates, when the health department gets the death certificates back and they come from the state, it's filled in what the cause of death was, right? But for many people, COVID was not the direct cause of death or the cause of death that was recorded on the death certificate. So we don't know.
But
it also doesn't say they have been vaccinated or not.
But they did get a death scholarship of $9,000 from their morticians, and that put them in the ground. And I believe they're still going on today if people's death certificate has COVID.
But the death certificate is the only data that the health department gets.
Should that be changed?
Kathy?
So, right, this is a large topic of conversation that I'm not sure that we have the time for tonight.
The one medical fact I'm going to throw out there is the mRNA, messenger RNA COVID vaccines or other mRNA vaccines to be developed in the future are not gene therapy. They are standard vaccines. The method by which they are produced is different. They are not genetic therapy. It is not acting on your genes in any way, shape, or form. The national data that we do have, and it's broad data, is that adults who were unvaccinated during the COVID pandemic had a higher death rate than unvaccinated adults against COVID. We don't have good local data, and the New York State death certificate, I'm sure Doug Ronner will agree with me, is a horrible system which we are not well taught how to navigate as physicians filling out death certificates. It really needs a lot of improvement. And there is no long-term data yet for serious long-term adverse effects of the mRNA COVID vaccines.
But there is SV40 genes, which goes all the way back to the Cutter incident with polio, giving people cancer today.
So I think right, I was gonna say, that's another panel discussion, I don't think
Please have
I
it.
think we're moving away from
Please
conversation.
have it.
So, yeah,
Sorry,
Very
I have a relevant question to the panel. It was talked about at the very beginning that long-term care is going to be affected with the cuts of Medicaid. What is going to happen because of that? Will people be getting additional insurance? And that will be more expensive. Will people just not be able to get long-term care?
Well, so long-term care insurance is a whole different beast, which is a completely private, voluntary thing, and which is essentially unaffordable for most people. And if you're in a nursing home and you've used up your personal financial assets, and then you can no longer pay cash per month, you then apply for and can qualify for Medicaid. There's no other insurance that's going to cover that. So if Medicaid cuts their reimbursement to the nursing homes are going to get squeezed. Those patients have no other insurance that will cover it. They have no other assets. By the time they're on Medicaid, that's all there is. And the worry is that either the care will get worse, and it's already pretty stretched, or nursing homes will close.
Well, they've impoverished themselves to get there.
Correct.
And can I also add to your point, Doctor, that it's not just long-term care nursing homes, it's also assisted living, other care facilities for our seniors that are also impacted with respect to these, because I wanted to make sure I added that to your commentary. Absolutely.
all right. On that note, once again, we have gone over time.